All right, let's dive deep into a really challenging and deeply human story today. We've got a stack of source material here.
Yeah, we do. There's a mother's own very personal account of giving birth in Israel. Plus, we have excerpts from her official hospital discharge report.
And some notes about her immigration status, which turns out to be pretty crucial.
Absolutely critical. Our mission here is really to unpack this whole experience. It's not just the medical side of labor and delivery.
Right.
It's about how her personal feelings, the clinical facts from the hospital records, and these really key external things like her visa status, her financial situation, how they all got tangled up.
And how they shaped everything that happened. We're sort of piecing together the full, complex picture from these different angles.
Exactly. We want to see how the medical journey played out, but also alongside these very real logistical financial hurdles she was facing.
It's a powerful look at how different kinds of information tell, well, different parts of the same story, but they're all completely interconnected.
Definitely.
So let's set the scene a bit. We're talking about a first-time mom. She's an immigrant living in Israel.
And right off the bat, like you said, her visa status is absolutely fundamental here. She was on a B1 visa,
Oh.
and she was actually due to receive her A5 visa in July. But the timing was key.
Ah, so because she didn't have that A5 before giving birth.
Exactly. It meant she didn't have the same rights as citizens yet, specifically missing out on that full, free national health care coverage for the birth itself.
That lack of coverage sounds like a huge factor. It must have impacted her decisions early on, how she interacted with the system.
Immensely. And even before we get to the delivery day itself, her personal story talks about significant health issues leading up to the due date, May 17th.
Like what?
Well, severe abdominal and back pain for over a month. It got so bad she needed bed rest for the last month, and then constant abdominal pain in that final week.
So this wasn't just, typical third trimester aches. This was something more serious, more debilitating.
Precisely. She was going into this already really drained physically and emotionally from all that chronic pain. It set a difficult stage.
Which brings us right to her first trip to the ER. This was on her due date, May 17th, because the pain was just so severe.
And her account describes, well, hours of waiting. They did the standard fetal heart rate monitoring, which was normal, thankfully.
Okay, that's good.
But then she talks about seeing a young male ER OBGYN.
And how did that go?
Not well, from her perspective. Her husband tried his best to explain in Hebrew how constant and severe the pain was, especially on her right side and abdomen.
But she felt dismissed.
Completely. She felt the doctor basically categorized it as, and this is a quote, normal third trimester pregnancy symptoms for a first-time mom with low pain tolerance.
Oof. That low pain tolerance label, especially after weeks of bed rest for severe pain,
Yeah.
that must have felt incredibly frustrating, invalidating even.
Yeah. He did a physical exam, found she was 0 centimeters dilated, and basically sent her home. Told her to come back in 3 days unless her water broke or she had, true contractions.
Okay, and this is where that visa and insurance issue really bites, right?
Exactly. Her insurance only covered the actual delivery, not ER visits like this one.
So that visit cost them.
$500 out of pocket. And she says payment was required right then and there.
Wow.
It apparently wiped out her bank account until her next payday.
So think about that position. You're in agony, you feel like the doctor didn't listen, and now you're hit with this huge bill.
And you're terrified. You know something's wrong, but you literally can't afford to go back if they just dismiss you again.
That financial barrier, tied directly to her visa and insurance limits, created this massive fear. It directly impacted her ability, or maybe willingness, to seek help again quickly.
Huge impact.
Right.
So the very next morning, she wakes up and finds something alarming. Discharge, she describes blood, mucus, fluid.
And she was sure it wasn't just urine.
Absolutely certain, according to her story. This felt different, significant. Plus, mild contractions started around the same time.
But she hesitated to go back.
Understandably, yeah. That previous experience, the dismissal, and the very real financial stress, she was reluctant. Another $500 hit if they sent her home again. She couldn't risk it.
But the contractions got stronger.
They did. After about 4 hours, they weren't mild anymore. Stronger, consistent about every 6 minutes, lasting a minute each time. The pain was escalating.
So they decided they had to go back, despite the risks.
Yes. They went back for a second ER visit, bracing for another long wait, another potential bill.
And her account mentions waiting for hours again.
Yep, hours again. And adding to the difficulty was a significant language barrier. Most staff spoke only Hebrew.
So her husband had to translate nearly everything.
Pretty much, yeah. vital communication relying on him.
Did she see a different team this time?
She did. A female obgyn, who was apparently training a younger female doctor, the trainee actually spoke English directly to her, which was a relief.
All right.
But the main doctor, the senior one, only spoke Hebrew and mostly just typed, so her husband was still crucial for translating that interaction.
And was this doctor more receptive?
Well, there was immediate conflict, actually. The main doctor handling her case was convinced that the fluid the mother had seen earlier was just urine.
Oh, no. So dismissing her certainty again.
Exactly. You can just imagine the panic setting in. Fear of another dismissal after everything.
Okay, but things changed,
Yeah.
despite that initial disagreement.
Yes, this is the critical turning point. An ultrasound was ordered.
And what did it show?
Her reaction, as she describes it, was shock when she saw the results. The measurements were barely different from an ultrasound she'd had back at 36 weeks.
Barely different, meaning?
Meaning the baby's abdominal growth had just stopped, completely stalled around 35 weeks. She was down in the 0th percentile for almost everything except femur length, just hadn't grown noticeably in weeks.
Oh my goodness. So what did that point to?
It led to this really critical and frankly terrifying diagnosis. The placenta wasn't working properly anymore. It had stopped functioning effectively.
So the baby was?
Essentially starving inside, not getting what she needed to grow.
Wow. And does the hospital report back this up?
It does. The discharge summary lists SGA antenatally small for gestational age found before birth as a key complication, so the clinical record confirms this finding.
Were there other issues noted in the report from before the birth?
Yes, a couple of others. It lists polyhydramnios.
Which is too much amniotic fluid.
Exactly. And interestingly, her personal story connects this. She mentions noticing excessive stretch marks, way more than anyone in her family, which makes sense if the uterus was larger due to extra fluid.
Okay, what else?
The report also confirms her status as post-date pregnancy. She was 40 weeks and 2 days, so past her due date.
Right. So based on the baby size, the lack of growth, the placental issue, what was the decision?
The decision was clear.
Right.
They had to induce labor. This couldn't wait any longer. The baby needed to come out.
Okay, so labor begins. She was already a little dilated, 1.5 centimeters when they made the call.
Right. And they performed a membrane sweep to try and get things moving.
They did it.
Oh, yes. Her personal story describes the contractions escalating incredibly fast, like fast and hard every 3 minutes, lasting over a minute.
Unbearable pain, she says. Couldn't walk or talk through them.
That's how she describes it, just overwhelming.
And where was she during this? Labor and delivery.
No, and this is a really challenging detail from her account. She wasn't moved there immediately. She was admitted to a high-risk pregnancy ward instead.
Why?
Apparently, the policy was she had to stay there until her cervix dilated to at least 2 centimeters.
So even with those intense contractions, she couldn't get full labor pain management yet.
Exactly. It significantly delayed her access to things like an epidural. Imagine enduring that kind of pain, knowing relief is available down the hall, but you haven't hit the magic number yet.
How long was she waiting there?
For 9 agonizing hours, according to her story. And after all that, she'd only dilated to 3 centimeters.
But that was finally enough to move.
Finally enough, yes. They moved her to the delivery room.
And I bet she asked for pain relief right away.
Immediately asked for an epidural. And interestingly, the anesthesiologist was apparently quite surprised by how frequent and strong her contractions were at only 3 centimeters.
So that kind of validates her experience, right?
Yeah.
The intensity wasn't just in her head.
Absolutely. It confirms her personal feeling, even when the physical exam didn't show huge progress yet.
Was getting the epidural straightforward.
No, it sounds like it was really difficult. She describes the anesthesiologist having to pause 6 times just to get through contractions.
Wow.
The first attempt actually failed. They hit a blood vessel. And the position itself, that arched back, was excruciatingly painful during those intense contractions.
But they tried again.
They did, and the second attempt worked.
What was that like for her?
She describes the pain just melting away. The first real relief she'd felt in over 3 months. Finding a moment of peace, putting on her labor playlist, feeling emotional, spiritual, elated.
A moment of calm after chaos.
A much-needed one. And labor did progress after the epidural kicked in. She dilated pretty quickly to 5 centimeters within about an hour.
Okay, good progress.
But then things stalled again. For about an hour and a half, no change.
So what do?
They decided to augment labor with Pitocin. The hospital report confirms this, listing it as oxytocin, which is the standard drug used to strengthen contractions or get things moving again.
Her story also mentions something else happening nearby.
Yeah, a really poignant detail. She remembers hearing a woman in the next room screaming in pain. She found out later that woman tragically had a full-term stillbirth.
Oh, that's heartbreaking. It must have cast such a shadow.
Rare.
And probably took up a lot of staff attention, too.
Very likely, yeah. Adds another layer of context to the environment.
So how did the rest of her labor go? The final stages?
Well, her account details her water breaking around 1 a.m. during a cervical check. The hospital report actually notes rupture of membranes post-vaginal exam, so that lines up.
Okay.
She reached 9 centimeters by 4 a.m., then fully dilated by 5 a.m. They had her labor down for a bit, let the contractions bring the baby lower before active pushing.
And when did she start pushing?
Around 7:20 a.m., she says. Initially, it was just her, a midwife, and a nurse present.
And the birth.
Her daughter was born at 7:55 a.m., according to her story. The hospital report lists 7.56, so basically the same time.
And the baby, after all that concern about growth.
Her story describes her as small but strong. And the report confirms the baby was actually doing well objectively. Weight was 300 and 340 grams. APGAR scores were excellent 9 and then 10, past her hearing scream.
That's amazing news. A healthy baby despite everything found beforehand. That must have been the biggest relief.
The ultimate relief, yes. But for the mother, her personal crisis was unfortunately far from over.
What happened postpartum?
She describes a really rapid decline, significant bleeding right after the birth, needing about an hour of suturing for tears.
Okay, that can happen, but then?
Then that severe abdominal and back pain, the same pain she'd had for months, came roaring back. Even worse than before, she says, once the epidural wore off.
Oh no, and other complications.
Yes. Things escalated quickly. She lost a lot of blood, became severely anemic. Her heart rate shot up to 150 BPM.
Wow, that's very high.
And she developed a high fever. The hospital report confirms a post-delivery fever reaching 38.5 degrees Celsius.
A fever like that after birth is a major red flag, isn't
Yeah.
it? Usually points to infection.
Absolutely, a big warning sign. Her own account paints a picture of just being in agony, trying to manage suture care, attempting to breastfeed her newborn, but becoming increasingly confused.
Diffused.
Yeah, like she couldn't communicate effectively. It got to the point where the nursery staff took the baby with her consent and gave her formula, which must have been devastating but necessary given her state.
So what did the doctor suspect?
By the next morning, based on her symptoms, infection was strongly suspected. The hospital report confirms this. It notes a suspected intrauterine infection.
And did they confirm it?
The report provides crucial objective data, an elevated CRP level of 223.
CRP. C-reactive protein.
Exactly. It's a marker for inflammation and infection. Normal levels are usually way down, like under 5 or 10. A level of 223 is extremely high. It's a clear sign of a serious infection or inflammatory process going on.
Okay, so the data backed up the suspicion. What was the treatment?
They took blood cultures and samples to identify the specific bacteria. She was moved to a private room and started on IV antibiotics immediately.
Which one?
The report lists vancomycin and ciprofloxacin initially, and later augmentin. These are heavy-duty antibiotics for serious infections.
And how did getting the IVs go? Sometimes that could be tricky.
This is where her personal story highlights a particularly distressing part that the clinical report, just wouldn't capture. She describes nurses having a terrible time placing the IVs.
Oh, really?
Yeah, trying multiple times, missing the vein, causing her significant fear and pain. She even overheard staff repeatedly calling the ER doctor, the one who'd ordered the ultrasound, asking if IV antibiotics were really necessary or if oral meds would do.
That must have been awful to hear while you're feeling so sick and vulnerable.
Right. But then there's this powerful moment in her account. That same ER doctor, the one who made the initial crucial diagnosis.
The one who ordered the ultrasound.
That's the one. She actually came down from the ER herself, and she placed the IV on the first try.
Wow.
And her account says it was the only pain-free infusion she received during that time. A moment of real skill and maybe compassion.
Did the mother recognize her?
Not at first. The doctor apparently asked, "Do you remember me?" And she didn't, not until her husband pointed it out. But the gratitude was immense. She thanked the doctor profusely in Hebrew.
That's quite a moment. It stands out even if other memories are hazy.
Exactly. She mentions her memory of those days is limited, mostly just pain and the difficult 5E attempts, but that interaction stands out.
So when did she start to turn the corner?
Her fever finally broke yesterday morning, relative to when she's writing or recounting this discharge day. She describes waking up feeling noticeably better, seeing her happy newborn daughter.
That's wonderful. What about feeding? She wanted to breastfeed.
Yeah, she was initially devastated that she hadn't been able to latch or breastfeed as planned because she was so sick, but she got help.
What kind of help?
They trained her on how to use a breast pump, and she successfully started pumping and feeding her baby her own milk exclusively. That made her really happy, gave her a sense of accomplishment.
A positive step amidst the recovery, and then discharge.
Yes, discharge happened this afternoon in her story, which lines up perfectly with the hospital report's discharge date of May 23rd, 2025.
How does she feel leaving?
She describes feeling dazed, understandably, but also overjoyed to finally be going home with her daughter.
But even after getting home, it sounds like she was still processing everything.
Definitely. Her personal account ends with these lingering questions, this reflection, still trying to fully grasp how she survived those last few months, especially knowing now about the seriousness of the infection underlined by that crazy high CRP number and the fact that her baby's growth had just stopped in utero.
And the hospital report gives that clinical confirmation, reinforcing how serious it was. Did it include recommendations for after discharge?
Yes, standard but important things. Continue the antibiotics specifically. The report mentions Augmentin for 5 days. Follow up with her primary care physician. And, crucially, keep monitoring for any returning signs of infection.
Wow. So when you piece it all together from these sources, it's quite a journey.
It really is. You go from that initial dismissal of her severe pain, which was perhaps influenced by, a perception of her pain tolerance, but absolutely compounded by those financial fears tied directly to her visa.
Right, the systemic barrier.
Through to that critical moment of diagnosis. The placental failure, the baby's growth restriction, revealed only by that objective ultrasound data.
Then navigating an incredibly difficult, painful labor, a lived experience that feels so different from the clinical summary phrase, normal progress of labor.
Exactly. And then plunging into that severe postpartum crisis, the infection confirmed by hard data like the fever and that really high CRP.
And finally, emerging into recovery, healing, but still reflecting, still trying to understand the gravity of it all.
It just powerfully shows why looking at all these angles matters so much. The personal story gives you the emotion, the frustration, the fear, the agony, those moments of connection or dismissal with caregivers.
And the clinical report gives the objective facts. The diagnoses, the lab results, the treatments, the baby's outcome stats.
And those notes on her visa, they provide that vital external context. They explain the systemic hurdles, why she might hesitate to seek care, the added stress. It shows how non-medical factors deeply influence access, how you perceive, and the care you ultimately receive.
It really brings us back to this fundamental point, doesn't it? We understand health, illness, through different lenses. There's our own gut feeling, our personal narrative.
Then there's the objective clinical data, the tests, the reports.
And then there's the reality of navigating these complex systems, like healthcare, like immigration.
And this whole story makes you wonder, what happens when those lenses show different pictures? When your personal experience of agony is dismissed clinically? Or when systemic barriers prevent you from getting help that objective data later shows was desperately needed?
Yeah. How do we bridge those gaps? It's definitely something to sit with and really think about.